Sharing my screen. Okay, so you should all be able to see my screen okay. So thank you so much for joining us this evening on this National Caregiver Day. What a great coincidence. As Catherine mentioned, so I'm Roxanne Dion-Boudreau, and I'm Regional Lead of Community Engagement for Eastern Ontario and Francophone communities with the Ontario Caregiver Organization. So our acronym is OCO. So today's webinar, we will focus on contingency and emergency planning for caregivers and their care recipients. So during this evening's session, you will learn a bit more about caregiving experiences, understand why and how to build contingency and emergency plans, learn strategies for implementing the plans, and gain access to free resources and supports that we have available through the Ontario Caregiver Organization. So I will be sending Catherine a follow-up email following tonight's presentation. So she'll be then able to share that with you. So the follow-up email will include a handout of the presentation, as well as the resources that we will be exploring together. So don't worry too much about taking notes. You can just focus on the session, and we'll be happy to share the information afterwards. So first off, the Ontario Caregiver Organization, what do we do? So we exist to improve the lives of Ontario caregivers. So ordinary people like you and I who provide physical and emotional support to a family member, partner, friend, or neighbor. So we support all caregivers in Ontario, regardless of where they live, their diagnosis, or age. And really, the Ontario Caregiver Organization was established in the spring of 2018. So we are a newer agency. We are an independent nonprofit with a board of directors, and we are funded by the Ontario Ministry of Health. So this diagram here shows just how the OCO works to improve the lives of caregivers. So at the center of our work are caregivers. We collaborate with caregivers to create programs and services that are all free of charge. We engage caregivers in our work through our advisory panel, working groups, as well as through conversations. And our work focuses on 5 key areas. So we offer direct to caregiver programs and services. We do some system outreach and collaboration. So we try to assess and address gaps in services within communities, local communities. We see where there are opportunities to work together and partner to build out existing services. We do public awareness through different campaigns. We just recently launched our Undercover Kindness Project campaign, which was featured on social media as well as global news. We then collect caregiver insights and engage caregivers in our work. So as I mentioned, through our advisory panel, working groups, as well as through conversations with caregivers. And we try to take that information and provide it back to community partners through our annual Spotlight report, which is an annual data set that we generate. So I will be highlighting a couple of statistics throughout the presentation, and those all come from our latest Spotlight report, so our 2022 report. And finally, we provide caregiver and public information, just like I'm doing tonight. So we do so through our programs and services, toolkits and publications, and the delivery of presentations and workshops within communities. So who are Ontario's caregivers? So we at OCO define family caregivers as family members, friends, or neighbors who provide care for someone without pay due to their frailty, palliative care, long-term illness, long-term recovery from an accident or a surgery, degenerative disease, physical or mental disability, or an age-related condition. So caregivers can be anyone of any age, gender, or geographical location. And there are many different caregiving circumstances where the type of care, to whom, where the care is provided, and for how long caregiving is provided will vary from situation to situation. So I'm going to present a few statistics. Don't worry, this is not the whole presentation. We will get into the meat and potatoes in a few minutes. So just to give you a snapshot of Ontario Caregivers, and as Catherine mentioned in her introduction, we estimate that there are 4 million caregivers across Ontario, and that includes young caregivers. So caregivers are represented across all age groups, as you can see. But the largest percentage of caregivers are aged between 26 and 64. And 48% of those caregivers in that age group form what we call the sandwich generation. So these individuals are likely to, on one end, care for someone who's older, such as a parent or an in-law. And on the other side, they're probably also raising a family and caring for children. We're seeing that caregivers age 65 and over are also on the rise with the aging of the baby boomers and also with the prevalence of dementia and Alzheimer's disease in aging adults. And as you'll notice, the vast majority, so around 64%, are also employed and therefore balancing caregiving and work responsibilities, and for many on top of raising a family. And then you can see also that caregivers are fairly evenly split between male and female. So what are the contributions of caregivers? So 34% of caregivers are providing more than 10 hours of care per week. And this has been steadily increasing throughout the pandemic. 79% agree that they have taken on a responsibility that otherwise would have fallen into the hands of PSWs or nurses. Caregivers across Ontario provide an estimated 75% of the care in our healthcare system. So caregivers' contributions are profound, and in fact, I think it's fair to say that caregivers are truly the backbone of our healthcare system. So if we try to put a dollar figure to the contributions of caregivers in the healthcare system, and this statistic dates back to 2020 when minimum wage was at $14 an hour, it would be between $26 and $72 billion each year. So absolutely enormous, the contributions that caregivers make in our society. So who are they? So most caregivers, so around 87%, are caring for one person, usually an older family member. There are 11% of caregivers who care for two people, and a small percentage, so 2%, care for more than two people. We're seeing that 49% of care recipients live with their caregiver, 37% live in another private home, and 11% live in healthcare facilities. So the impacts of caregiving can be significant, and we really need to consider them holistically. So caregivers say that it has an impact on their time, their jobs, finances, their own physical and mental health, as well as the relationships that they have with others. So in terms of time, so there's the time that's spent providing hands-on care, physical care, and emotional support. Time can also include long-distance caregiving. There are caregivers who are driving across the province to provide care. There's the time spent navigating system and services. So searching for those services, applying for various programs, talking to the right person from the right agency can all be very time-consuming. And there's also the time that is spent advocating for the care recipient. Of course, that time commitment can impact employment and work-life balance. So we're seeing an increase in caregivers leaving their jobs. Some are taking an early retirement. Caregivers are reducing their work hours. Some are going down to part-time. Some are refusing promotions, declining job offers, and many are using benefits that are intended for them, such as vacation or sick days, in order to provide care. Then in the last 2 years with the pandemic, we've really seen an increase in the cost of caregiving. So caregivers are spending more of their personal finances to provide appropriate or additional supports and resources in their community. Caregiver and care recipients are also very often codependent financially. So when the care recipient moves to a care facility or passes away, for example, caregivers can really find themselves struggling financially. Some have to move because they can no longer afford the place that they were residing at with the care recipient. Personal relationships of caregivers. So caregiving impacts relationships. You probably know that, you may have lost friends. You receive fewer visits from family. There might be a shift in some of the dynamics in spousal relationships, for example, when one becomes the caregiver and the other the care recipient. So all of this has a direct impact on the mental, emotional, physical, and social health and wellness of caregivers. So now that we've gone over examples of what you and other caregivers do every day and the impact that it has on your life, let's think through what this means for planning in case of emergencies or significant changes in the care model. So consider, do other people know the day-to-day tasks that you lead and the details needed to complete them? What would happen if you weren't able to care for the people in your life? Have you ever been faced with an emergency and didn't have access to the information you needed? So are these questions stressing you out right now? So let's now take a look at how we can plan ahead to minimize these additional stressors. So why caregivers need a contingency plan? So caregivers provide, like I mentioned, an average of 11 to 30 hours of care per week, supporting a family member, spouse, friend, or neighbor. The physical and emotional support provided by caregivers is crucial to the health and well-being of the care recipient. So then what happens when that caregiver needs support? So our Spotlight report revealed that 2/3 of caregivers say they have experienced feelings of helplessness, burnout, and find it difficult to continue with their caregiving responsibilities. And almost half of those caregivers have been in their role for less than 2 years. So with burnout at an all-time high, caregivers need their own support networks and a contingency plan for the person that they care for. So here are 5 steps to help you build a contingency plan, and we will go through each one of these together. So first, you need to reflect, review privacy and consent guidelines, build your team, document your plan, and stay connected with the team. So the first step in building and implementing a plan is to reflect. Reflect and take stock of everything that you do on a daily basis when it comes to daily living tasks, appointments, bill payments, etc. So what information is required to complete these tasks? So for example, mom needs help to get dressed, but she has a frozen shoulder and can't lift her left arm up over her head. That's something that someone would need to know if they're helping her get dressed. Jack requires insulin. He can inject it himself, but you need to set the dose for him. So what is the appropriate dose? Another question that you can reflect on is, what are the most urgent care needs? Some medications need to be taken at a specific time. For example, Parkinson's medication are very time sensitive. Emptying a urine catheter bag or an ostomy bag frequently. These 2 tasks are probably more urgent than making sure that the care recipient washes their hair, for example. What are the things that you find the most challenging? So it could be a task that is challenging physically, like for example, helping your spouse weight bear when you're helping bathe them. It could be a task that you find time consuming, like doing the groceries or picking up medication. It could be repeating the same thing over and over again. What things do you enjoy doing with or and for your care recipient? Perhaps you really enjoy helping them into bed at night and having that little intimate moment with them. Maybe you like brushing their hair while reminiscing about old times, or maybe you like going out for a drive together. Are there some items that can be shared? Are there some tasks that can be shared with others? For example, can somebody else go run some errands for you? Can somebody else help you with bathing if you find it physically challenging? So these are all questions that you can follow in order to reflect, in order to start building and implementing that plan. So the tool that we're suggesting to start helping you make that inventory of everything that you do for the care recipient during a day is our I Am the Caregiver toolkit. So on page 3 of this toolkit, you'll find this lovely little activity list. So feel free to change or add any activities so that the activity list is up to date and really reflective of your own experience. Perhaps, the person you care for may not need help with bathing, for example, but might need help with dressing. So the first step is to make sure that the list is up to date and reflective of your situation. You can then think about the people in your life that may be able to help you with some of these activities. For example, maybe a family member can help you with banking or paying bills. Maybe somebody else can help prepare income tax. The second step in building and implementing a plan is to review privacy and consent guidelines. So whenever possible, you want to work alongside your care recipient to plan ahead, get their consent to share and document information. So give them a voice in the process. You want to ensure that they know where documents are, contact details, etc. So the Ontario Caregiver Organization recognizes that you can receive and record this private and confidential information based on the following scenarios. So if the care recipient or patient has consented to their healthcare provider to share personal health information with you. Under the Healthcare Consent Act, the care recipient has been legally tested for capacity to consent and deemed incapable, making you the substitute decision maker. The substitute decision maker provides consent for the collection, use, or disclosure of personal health information of the care recipient. So the Ontario Caregiver Organization encourages you to ask the care recipient's healthcare provider for a copy of their written consent or consent to disclose personal health information form that the care recipient can fill out and sign in order to make you part of that care team and being able to share some of that information with you. And you also want to make sure that the healthcare provider's staff are aware of the documented consent. So even when the care recipient has consented that their information can be shared, some caregivers still struggle to get timely information from providers. So sometimes healthcare providers need a little reminder that they are permitted to share certain information with caregivers based on the consent the patient has given. This information was sourced from Making Privacy and Consent Rules Work for Family Caregivers. And that was a resource published in 2017 by the Change Foundation. So other resources that you can access from the Ontario Caregiver Organization to help you review those privacy and consent guidelines. So make use of the many health privacy and consent resources that are available on our website. These resources are adapted from materials that originally were created by the Change Foundation and one of its changing care teams. So you can see here that we have a little booklet on understanding health, privacy, and consent in Ontario, as well as other FAQ section on our website. The third step in building and implementing a plan is to build your care team. So you need to decide who you can trust to provide support. Who should be your emergency backup in the event you cannot provide care? Who can provide long-term support? For example, perhaps a neighbor can help you out in a short-term measure, but perhaps they're not able to support you in a long-term run. What are the next steps for the emergency contacts to follow? Who do they contact next? So consider family, friends, neighbors, and professional care providers. So we often see that when something happens, right? Somebody's hit with a diagnosis, somebody's had a surgery. You always have those people come to you and they might bring you a casserole or they baked you a lasagna. And they come to you, they knock at your door and they say, oh my gosh, I'm so sorry to hear this. If ever you need support, if ever I can do anything for you, please let me know. And then you don't hear from these people again. So now is a good time to think back and go back to these people and say, remember when you offered to help me? So I've given thought to that, and perhaps you could help me with, perhaps you can help John, drive him to his adult day program back and forth once a week, or, can you come and sit with John for an hour once a week while I go and take care of myself a little bit? So, and if you don't have anybody that you can trust, you may consider looking into future options, such as the public guardian or assistive living list for the person that you care for. So we have a collection of advanced care planning tools as well, available on our website. So you can make use of these tools as well as the tools in the Contingency Planning for Caregivers information booklet that I will be sharing with you in the follow-up email. There's also advancedcareplanning.ca that can be a helpful resource as you make these decisions for the person that you care for and yourself. The fourth step in building and implementing a plan is to document everything that needs to be documented needs to be in one place. So things to include: contact information for the care team, including professionals, details about the care provided, care considerations, appointments, financial details, and where to find other important documents and records. So the tip sheets in the contingency plan worksheets can help you to document your plan. So as you can see here, I know these are a little small, but these are all sheets that you can find in the Contingency Planning for Caregivers booklet. So basic information about my care recipient, my care team, services in place, emergency care directive. There's place to jot other notes. And examples for the documentation section. So as I mentioned, provide contact information for doctors, clinics, pharmacy, neighbors, home and community care managers, food delivery services, for example, and backup caregivers. Information about the care recipient's condition, as well as medical history, allergies, and any medical alert information. Provide a schedule of planned visits from home and community care providers. For example, if the PSW comes every Tuesday at 2 o'clock, you want to make sure that that information is in there. Include information about their likes and dislikes, routines, food preferences. Make a schedule of what you do and when, and provide enough details that someone else can take over. List the names and doses of medication and when they are to be given. Have enough medications for 2 weeks in case you cannot get to the pharmacy to refill prescriptions. Ensure all your medications have refills available. Include directions around bill payment. and directions around emergency care. For example, no blood transfusions, a do not resuscitate order, next of kin, or power of attorney information. So there's definitely a lot to take into account, but the contingency planning for caregivers booklet can really help you put your thoughts into order, and kind of shows you which areas you need to focus on, and think about what you need for your plan. So the final step in building and implementing your plan is to stay connected with the team. So you want to ensure that they have access to the needed documentation. So does your backup person know where all important documentation is stored? Do they have a copy of the contingency plan? You want to keep those team members updated on any major changes. And then determine how often you need to connect and plan to review. So you might want to set up a recurring phone call every 2 to 3 months. Maybe you want to put it in your calendar to make sure that you save that time and you don't forget. Ensure that team members have an updated copy of the contingency plan and that they really understand their role and what you expect of them. Another resource that we have available is the Healthcare Journey Binder, which is another tool that caregivers can use to store information in one place. So the binder can help improve communication among care team members, including healthcare providers and other family members. So use it with your care recipients to communicate and manage healthcare information, appointments, and to document questions. So contingency planning is definitely one way to plan ahead, but no matter how much we try to plan ahead, emergency situations can happen to anyone. So this is why we also need to prepare for emergencies. You need to ensure that the person that you care for can access assistance in an emergency. So are they able to dial 911? Maybe they need that alert button. So in case they fall and they need to access emergency assistance. You need to prepare if the person you care for goes missing. You need items. You want to make sure that items are available in case you are unable to reach the person you care for due to unforeseen events. You and others on the care team know of services that can help. Emergency service providers have easy access to the information that they need. So should an emergency involve a health concern, a missing person incident, fire, flood, safety concern, this can happen to the person that you care for, to you, or both. So information needs to be provided clearly and in a timely fashion in an emergency situation. So you want to make it easy to get the help that both you and the care recipient need. So here are a few ways that you can prepare. So along with the contingency plan, following these steps and completing an emergency information form can make emergency situations less stressful for you and the person that you care for. So first of all, research. So based on the condition of the care recipients, what are the needs and what supports are available for both of you? So consider local vulnerable person registries. Local EMS often have emergency kits, so an emergency contact card. Consider medical alert bracelets. A wellness check programs. So some community support service agencies provide safety checks. So a little check-in call once a day. There's mobile crisis teams, shelter, supportive technology. So the Aging and Innovation Research Program at the University of Waterloo, in collaboration with the Alzheimer's Society of Ontario and Age Well NCE, they've compiled a list of locator devices and technologies that you can find on the University of Waterloo's website. So it kind of tells you all the different technologies available when it comes to supportive technology, and you can compare them. So I'll be happy to share that website with you. Get myself a little note here. And then there's also our 24/7 caregiver helpline that we offer here at the Ontario Caregiver Organization. So the helpline can assist you in getting connected to some of these services. So I will be sharing that information with you in a couple of slides here. Then you need to plan. So identify safety measures together in the event of different types of emergencies. So have emergency numbers on the fridge for each person's cell phone number for easy access, for example. And that emergency sheet that we're talking about creating, it's also recommended to store it on the fridge or behind the door. I've been told that those are the places that EMS will look at for such information. So then consider safe places to meet in the event of an emergency. Have any emergency services number handy. What to ask for from emergency services, and others that you can call for support. Document and review. So create a contingency plan as described earlier and fill out an emergency information form and make it accessible for emergency services. So like I just mentioned, putting it on the fridge or behind the door. Do you have an advanced care plan, POA, substitute decision maker? Is the care recipient able to provide consent in planning? So store those key documents together. Fill out the emergency information form and make it accessible. And review and update the plan frequently and as needed. Then consider, do you need non-perishable food items or water stored away? You know, if you know that in the event of an emergency, there's a huge snowstorm, you can't reach that person that you care for. You want to make sure that they have enough supplies set aside that, you know, they won't be in a crisis if ever, you know, you can't make it for a couple of days. Do they have extra medications in the house? Is there access to a first aid kit? So consider reaching out to community support services in your area as well, as they might be able to help you prepare. So this is especially important when the person that you care for lives alone. If you are connected to community support services, like I mentioned, they can be of assistance to you as you prepare. So in terms of documentation, so OCO has adapted this form with permission from the Alzheimer's Society of Ontario. So the form outlines basic personal information and physical descriptions, including a picture, conditions or illness, health and wellness overview, communication tips, as well as POA and emergency contacts. So you want to put this completed package on the front door or on the back of the front door or on the fridge so that the emergency services can get an understanding of who is in this space and what they may need. This can also be super helpful if a vulnerable person goes missing. So call 911 right away and provide this package to the police, right? Because it will have their picture on it, all their medical conditions. So really easy in a panic, the person's missing, to hand that little package to the police. So maybe consider making photocopies as well. So keep an extra copy put away in a safe place. So definitely then make a couple of copies and make updates as required. So that was a lot of information. So we have a number of tools to help you prepare and implement these plans. So here's some to get started. So we'll review quickly. So the emergency information booklet and contingency plan tip sheet. So those will be shared with you. The I Am a Caregiver toolkit can really help you make an inventory of all the tasks that you do and help you identify who maybe you can delegate a tasks to, who can help you. The Healthcare Journey Binder was created by caregivers and healthcare providers to help improve the overall healthcare experience of people with an illness, disease, or medical condition. So it can be used by anyone. So you could have one for yourself as well as for the person that you care for to manage important healthcare information. So one, it provides one place for all the documentation to be in. It makes it easy to organize and find health information. And it allows you to easily share that information with the healthcare team. Then there is information on health, privacy, and consent in Ontario, as well as advanced care planning information that is available on our website. And I will also share those links with you. So what does the OCO offer for caregivers? Well, we have a number of different programs, services, and resources. So I will provide an overview for you. So we offer two different websites. So we have ontariocaregiver.ca, and then we also have youngcaregiversconnect.ca, which is a site specifically dedicated for young caregivers aged between 15 and 25. Other resources that you can find on our website. So we provide a monthly e-newsletter for caregivers. We have tip sheets, we have diagnosis-specific content. For example, we have some on cancer, dementia, heart disease, and so on. We have resources for Indigenous caregivers, resources for Black caregivers, resources for 2S LGBTQ+ individuals. We have a COVID-19 resource center, a podcast. You can find our upcoming events as well on our website. So in terms of our podcast, so the podcast is called Time to Talk. It's hosted by Michelle Jobin, along with experts and caregivers to discuss things that matter most to caregivers. So you can find our podcast on all major podcast platforms. And season 3 episodes were just launched last week. And they include topics such as walking alongside Indigenous peoples who are seriously ill, education for community caregivers curriculum, caring for someone with dementia, PTSD in caregivers. So I'm really just naming a few here. There are 10 episodes in total. Now here are programs and services offered by the Ontario Caregiver Organization. So we have the OCO helpline, peer support, we have our SCALE program, we have webinars, e-learning, as well as something called the 90-second caregiver. So first off, the Ontario Caregiver Organization's helpline. It's a one-stop to gather information about the services available to you in your community. So to get connected with what you need. So if ever you want to find out about those support services in your community, to make it part of your backup plan, you can call the helpline to find out what's available to you. The helpline is answered by community resource specialists that have received a specialized training so that they really understand some of the unique challenges that come with caregiving. The helpline operates 24/7 through phone. There's also a live chat that's available Monday to Friday from 7 a.m. to 9 p.m. It's available to all Ontario caregivers. Translation is available in over 150 languages. And it's free of charge, of course. So the only thing is that it's important to note that it's not a crisis line. But if ever somebody does call and they are in crisis, the community resource specialist will direct them to the appropriate emergency services. So we offer a one-to-one peer support program because many times caregivers say that they just want to talk to others who understand their situation or can offer practical advice, and experienced caregivers really know best just how to do that. So mentoring is one method of passing on that lived experience to support another caregiver in an empowering and meaningful way. So the mentors do receive training from OCO on how to be a mentor, but more importantly, they have that wealth of experience and knowledge, which can help another caregiver with the challenges of their caregiving situation. And the one-to-one peer support program is a phone-based program. We also provide online peer support groups, which are facilitated by facilitators who are or have been caregivers themselves. There are several groups to choose from offered at different days and times of the week, and most run twice per month. So our support groups are not diagnosis specific. So really, they focus on the commonalities experienced by caregivers. We offer a lot of webinars, so we cover a wide range of topics, as you can see here on the slide, with a strong focus on webinars aimed at caregiver well-being to help caregivers feel less alone and provide them with a variety of info and resources to help them in their role. So we usually have 1 to 2 webinars a month in English, and we do have 4 a year in French. So all of our webinars are also recorded and available on our website and our YouTube channel. And if you are interested in registering for any upcoming webinars or other events, I really encourage you to look at our events section on our website. And make sure to sign up for our newsletter as well to find out about all these upcoming webinars and events. So just to give you an idea, these are the webinars that we have coming up. So we have Make Your Voice Heard, Tips for Effective Caregiver Communication coming up on April 21st. And then we have Caregiver Mental Health, How to Reduce Anxiety for Better Living. And that one will be held in May. And for those caregivers who want to learn more on their own time and have access to the internet, OCO offers free of charge self-directed e-learning courses. So you can see here that we have 3 available at the moment. Caregiver 101, Caregivers Partnering with Health Professionals, a strategy that works, and Roadmaps to Caregiving, the Realities of Mental Illness and Addictions. 90-second caregiver. So caregivers often say that they're too busy to care for themselves, and as a result, we know that many experience burnout, depression, isolation, and loneliness. So the 90-second caregiver is a really cool concept that was created by Dr. Patrick McGrath, who's a Canadian clinical psychologist who works with a team of healthcare experts dedicated to providing succinct, accurate health information for caregivers. So the information provided can really help improve overall wellness, self-confidence, and increase the ability to manage the stress that often comes with caregiving. So the letter takes approximately 90 seconds to read and includes information about a relevant health topic, practical tips, and a self-assessment survey that is followed by personalized insights and suggestions. So again, I really encourage you to sign up for 90-second caregiver. So I'm wrapping up here, and then we're getting to our Q&A question period in a few seconds. I just want to mention briefly that the OCO does share its expertise with other organizations. So we work with organizations who support caregivers or who want to support caregivers. So we do share insights that are learned through our annual Spotlight survey and gathered through our collaborations with caregivers. So we also support by helping with training and capacity building, connecting caregivers to organizations who want to engage on program development, etc. And caregiver voices. So as I mentioned, of course, the OCO is inspired by caregivers, but more so, our work is informed by caregivers. So we use an online platform to support caregiver insights and engagement. So it's called Caregiver Voices. And as members of the panel, caregivers are asked to provide input on different ideas, tools, and programs, answer questions on different aspects of the caregiving experience, and provide insights to guide the development of caregiver-focused service, webinars, and more. So in addition to projects from the OCO, we are also frequently asked to connect researchers and other stakeholder organizations with caregivers. So when appropriate, we share these invitations on the platform and connect interested members with the relevant parties. And this concludes my presentation, so we can start the Q&A section.